Hello, welcome back. We are now going to discuss type 2 antibody mediated hypersensitivities. And we just finished type 1 and we're going to now discuss type 2. So let's think about this type of hypersensitivity. Remember, just as a quick summary, the antibodies that cause disease in type 2 most often are autoantibodies against self-antigens, and less commonly are specific for foreign antigens, e.g. microbial antigens. So remember, these are mostly autoantibodies against self-antigens. Anyway, to begin with, what is the type of immunoglobulin that binds to fixed antigen on cells, which then leads to lysis or phagocytosis? What are those two immunoglobulins, those antibodies? Well, they are IgM and IgG. And can you think of the three mechanisms that cause disease, the three main mechanisms? Okay, firstly, the mechanism that binds antigen and target for phagocytosis of cells. Then we could have complement and Fc receptor mediated inflammation and tissue injury. And finally, interference of normal cellular function by binding to physiologically important molecules of cellular receptors. So let's talk a little bit more about this in detail. Type 2 cytotoxic or antibody reactions. These involve the activation of what by IgG or IgM binding to the antigen cell. Of course, that is complement. And what would be the result to the antigenic cell? It would be lysed. An example of this, of course, would be transfusion reactions. So when you're thinking about type 2 cytotoxic reactions, think about the reactions to blood transfusions. So firstly, ABO, blood group system. Remember that type O is the universal donor, and an incompatible donor cell would be lysed as it enters the bloodstream. And do you remember which RH, is it RH positive or RH negative, which represents 85% of the population? It is RH positive. Let's think about hemolytic disease of newborns. In this case, fetal cells are destroyed by maternal anti-RH antibodies that cross the placenta. Now, when talking about type 2 hypersensitivities, there are three main types that can be discussed. For example, A, complement and Fc receptor mediated inflammation, B, opsonization and phagocytosis, and C, abnormal physiologic responses without cell injury. This is the important point, that it is without cell or tissue injury. When we talk about type 3 hypersensitivities, then we will be seeing more of a tissue or cell injury. Anyway, let's focus here on on C, abnormal physiologic responses without the injury to the cell or tissue. So one example could be the antibody against the TSH receptor in the thyroid gland. And this would affect the thyroid epithelial cell. And interestingly, what would happen here is even though this receptor is blocked, it would result in activation of the thyroid cells, and the antibody would stimulate the receptor even without the hormone. And this would be an example here of Graves' disease. So what happens in Myasthenia gravis? Let's think about the acetylcholine receptors. In this case, the antibody to acetylcholine receptor, this would block the receptor here, and the antibody would inhibit binding of the neurotransmitter to the receptor, and this would result in myasthenia gravis. So continuing on, let's talk about drug allergies with type 2 hypersensitivities. So in drug allergies, we should remember that the administration of certain drugs is known to induce a type 2 reaction resulting in, for example, hemolytic anemia and thrombocytopenia. So when you think of penicillin, what is happening here? Why is this causing a problem? What is happening here with the penicillin is that it is modifying the proteins on the human erythrocytes to create foreign epitopes. And remember that in this type 2 hypersensitivity, we're talking more about blocking rather than destroying. In this type of hypersensitivity we're talking about now. Let's talk, just review what we mentioned earlier about Graves' disease and Myasthenia gravis. Remember that these antibodies involve reactions on the cell surface molecules without the cytotoxic destruction of cells. We're going to see that later. So with Graves' disease, what would be happening? We just discussed it. Can you remember? The antibodies are attaching to receptors on the thyroid gland and stimulating the production of thyroid hormone. Even though they're blocking the receptors, they're stimulating the production of thyroid hormone. So what symptoms would you see? You might see a goiter or enlarged thyroid and bulging eyes. How about with myasthenia gravis? Here we would have progressive muscle weakness as the antibodies block acetylcholine receptors at the neuromuscular synapse. And how many Americans does this affect? This would affect mainly women, 25,000 Americans. And today most patients survive when treated with drugs or immunosuppressants. Okay, next let's have a little quiz. What is ITP, or idiopathic thrombocytopenic purpura? Well, this is seen with an auto antibody to platelets. This is most often seen in women after bacterial or viral infections. And what autoimmune disease is idiopathic thrombocytopenic purpura associated with? Of course, this is associated with systemic lupus erythematosus, or SLE. And summarizing some of these problems here, let's talk about some of these problems with type 2. We'll talk about the antibody-mediated disease, the target antigen, and the clinical pathologic manifestations. We just talked about myasthenia gravis affecting the acetylcholine receptors and resulting in muscle weakness and paralysis, and also Graves' disease resulting in hyperthyroidism, and the target antigen here is affecting the thyroid stimulating hormone TSH receptor. And how about Goodpasture syndrome? What happens here? What is the target antigen in Goodpasture syndrome? This is non-collagenous protein in basement membranes of kidney glomeruli and lung alveoli. And the result would be nephritis, lung hemorrhages. How about autoimmune hemolytic anemia? What is the target antigen here? Erythrocyte membrane proteins. We're talking about Rh blood group antigens. And this would result in hemolysis or anemia. How about pernicious anemia? This would involve and affect the intrinsic factor of the gastric parietal cells, resulting in neutralization of intrinsic factor, decreased absorption of vitamin B12, and this would result in abnormal erythropoiesis, anemia. So try to remember these type 2 problems that result as There's a difficulty with this hypersensitivity in type 2, which remember is not resulting in a great deal of damage to tissue or the cells, but is causing a lot of problems. So tune in next time as we talk about type 3 immune complex mediated hypersensitivities.